In the spirit of reconciliation, we'd like to begin today by acknowledging the traditional owners of the various lands we are coming on together. I'm coming to you from Whadjuk country in Perth. We recognise their continuing connection to the land, sea and community. We pay our respect to their elders past and present, for they hold the stories, the traditions, the cultures and the hope for their people. Welcome. My name is Linda Thompson and I am a blood cancer support coordinator and a haematology nurse. Along with my colleagues, Tani Hodges, a clinical content producer with a background in haematology nursing, and Linda Saunders, who's our National Education and Support Group Program Lead with a background in cancer social work, will be running today's seminar. In this final session on autologous stem cell transplants, we will be considering post-transplant care, what to be aware of in the weeks and months following discharge from hospital, return home and long-term effects. This will include identifying and managing side effects, recovery and rehabilitation, as well as vaccinations. So just a little housekeeping. So before we go on, so it's a recorded session. So keep your cameras off and your microphones on mute for the presentation part. You can add questions and comments in the chat. These will be collated and addressed in the Q&A after the presentation. We have shared the pre-submitted questions with our guest speakers already. We are not able to answer specific medical or highly personal questions. And then, as Linda mentioned earlier, if you have your screen on speaker view, you'll probably experience the whole seminar better. Okay, so first off, I'm going to introduce our first consumer. Unfortunately, Michael is having a few technical issues and we're unable to see him, but we can hear him loud and clear. Michael is a 76-year-old and he lives on the mid-north coast of New South Wales. He had myeloma picked up by his GP in a regular thyroid test in late 2013 and confirmed in 2014 with more tests. He had chemo for 16 weeks and Zometa for around 2 years and then a stem cell transplant in April 2016. All right, Michael, can you tell us a little bit more?
Okay, thank you. I had my autologous transplant at the Prince of Wales Hospital in Sydney, April of 2016. And after 21 days, I walked out the front door and tried to walk back to the accommodation that we'd organised. Big mistake. About an hour later, my wife was telling me off for trying to do something stupid. I fell inside the front door, fell on the bed and slept for 9 hours. Something had hit me that hard and I just didn't know what it was, and I didn't wake up to what it was. 2 days later, we headed home, got back to where I live, as the lady mentioned, up on the mid-north coast of New South Wales. Drove in the front gate, there was the tractor, there was the ride-on mower, there's the fencing. On a small rural property is where I live. There's the horses that we can work with. And I thought, all these things, I'll be back doing this in a couple of weeks. That was wrong also. Got out of the car, walked around, tried to walk up a slightly sloping front area to get towards the front door. Couldn't do it. My wife had to help me inside, plonked me down in the chair. I slept for another 4 hours. When I woke, the first thing I looked at were the stairs inside the house. I'd forgotten about them. 8 steps up, a landing, another 8 steps, I'm upstairs. That night, I slept downstairs. The next day, I made a promise to myself that every night I would go up those stairs, shower and go to bed. Every morning I would get up, I would shower and come down. And that is something I really was strong about, and I made sure that I did it every single day. What I didn't understand, there's a lot of things that happen in between, every day and every hour. What I didn't understand was this thing that had taken hold of me. You go to work and you come home absolutely drained after a hard day's work. You play sport, you come off the field and you are absolutely worn out. But you can go and have a shower, recover, and away you go again. This thing that had hold of me, this fatigue, I'd never experienced it before. And it just grabbed you by the scruff of the neck, sat you down on the seat of your pants and said, I'm in charge. And it was in charge. I never really could understand that I couldn't do what I wanted to do. This thing had me absolutely flat out. I just had to try then to work out, how am I going to get around this? How am I going to get on top of it? And rehab was what I needed. To my wife's absolute pleasure, we started making lists and I had to tick off every little thing that I had a win on. Coming down the stairs every morning, tick. Going up, tick. Having breakfast, tick. Feeding the cat, tick. Feeding the dog, tick. Every silly little thing we put on the page, and I ticked it every time I achieved it. And it was like little stepping stones that I was using against this great big giant that had hold of me. And all the little stepping stones gradually became steps. I take out some of the stones, and there was a step, then there was a stride. And I gradually, and I mean gradually, it was a lot of sit downs, poppy naps, plenty of poppy naps, but I made sure I was actively doing things all the time. I started reading again. I started doing little arithmetic things in a book, make up sums and add it up, multiply them, do whatever. Every time I felt tired, I'd fight it. I'd get up. I'd go outside. Didn't always succeed. Sometimes I'd just go straight back inside, fall down into the chair and sleep. And there was plenty of that. But gradually, I got on top of this. Support. Support was just absolutely so important. And the rocket Gibraltar, without doubt, was my wife. She was full-time teaching and looking after me morning and night at the same time. And I can be pretty difficult. And I don't know how she did it, but she did. My GP, I had full access to my GP, and he was a brilliant GP. And he also was a myeloma sufferer. And him and I had a lot of great visits. I pitied at times the people waiting in the waiting room to come in after me, because our visits were fairly long at times. The haematologists, the nurses, I was still having some meta treatment, all the nurses at the hospital, family, friends, spent hours on telephone saying hello to people, and people ringing me, telling me to get off my backside and go and do something. Particularly one mate who was going through cancer treatment as well. We used to ring each other and say, get off your backside and do things. Keeping active was absolutely one of the big things that I think helped along the way. All your other things were happening, like you had to. You got sent home with a great big bag of goodies that catered for everything. So you were well catered for in your medicines and everything, and you had access to everyone. You all had to do was pick the phone up. There was support people everywhere for you, and all you had to do was work out how you were going to get around all these things. Gradually, I could feel myself getting on top of it. After 2 months, I went around and I walked up the steepest part of the hill outside my house. And I come inside, got the biggest black texter I could, and put a big black tick on the page. And that was when I thought, I've got this thing. I'm on my way back. It took 3 months before I got on the tractor. I never drove a car for 3 months. I just didn't have the energy to do it. I got on the tractor after 3 months, and when I went and did the first lot of mowing, I knew I was right. After about 6 months, I was back doing basically everything. And after 10 months, I felt as good as gold. I'm probably maximum 98%. Even now, everything's a little bit of a struggle, but that's because of other things as well. Along the way, there was hiccups. I had an ablation on a left kidney. I had shingles. I had kidney stones. A couple of little male procedures I had to have. We all went through COVID, and that's a whole other issue on its own. Like vaccinations, I think I've had 4 vaccinations against COVID. All these things pop up, you just handle them. They're just blips on the horizon, and you just got to make sure that you've got something in place that will take care of it all. Lots of blood tests, and like, as I said, I was still having some meta treatment, but it's all part of the recovery. I've been in remission for 7 years, and it's been really good. Yeah, there's been ups and downs all over the place. Next year, my wife and I are going off traveling, and as I said, I've been in remission for 7 years. May this year, unfortunately, it reared its little head again, and it is on the way back. One day we knew that the myeloma would come back, and it looks like it is on its way back, but it's coming back very, very slowly. And if it was on a graph, it'd be millimetre at a time every 3 months or 4 months. So it's going to take a while. I'll get back into chemo sometime down the track. We'll travel and manage that around chemo, or we'll manage chemo around travel. If you're there and you're considering a stem cell transplant, go and have it. Thank you.
Thank you so much, Michael. I love how open and honest you were about the reality of your recovery, and I think there's some great strategies about how you managed that in that little expert of what happened for you. So now we're going to go on to our lovely guest speaker, Trish Joyce. Trish is a clinical nurse consultant working in the field of haematology with a particular focus on myeloma and autologous transplantation. She's been doing that for more than 20 years. She has particular interest in the development of ambulatory care systems to support the improved patient experience in the outpatient setting. Trish also collaborates with the infectious disease team in the delivery of the post-transplant vaccination service at Peter Mac Hospital. Thank you, Trish. The floor's all yours.
Great. Thanks, Linda, and thanks to the LFA team for the invitation and to join you this afternoon, and to all our participants. So it's a real honor to be here today. So I'm just going to share my presentation. I hope you can all see that. As Linda said, I work in the field looking after patients with multiple myeloma, and particularly autologous stem cell transplantation. Looking after patients with autologous stem cell transplantation includes patients with lymphoma as well, and sometimes a smattering of other types of cancers as well, but predominantly patients with lymphoma and myeloma. So I thought I'd start with this slide to begin with. Basically, this is the Boston Marathon, and that's people who have completed it and crossed the line, and are elated, as you can see. And so for people going through a transplant, once you're ready to go home, it's a super exciting and a huge relief. But it's almost like you end one part of the treatment and start another. And as Michael so eloquently described it, that fatigue factor is just enormous and can be quite frightening, and something that I find in my years of looking after all of my patients, it's even though we talk about it in the pre-transplant setting and prepare people for it, it still is almost indescribable when you reach that point. And I guess today it's about normalizing that to an extent for you, and just arming you with some tools that you can use to be able to manage that. And Michael described again some really, really good pertinent points that you can adopt. But I think going through a marathon is a huge ordeal. It's a huge, a feat, and going through a transplant is exactly the same. However, when you come to the end, there can often be this almost let down feeling, because you think, hey, I've done it, I'm there. And now you get home and you want to do all those things, and suddenly you realize my mind is willing, but my body just can't keep up with me right now. So I'm sure a lot of you feel like this at different times during your treatment, and particularly the one that I wanted to highlight is this one here, basically. And for me, I run a clinic where I see all of my patients, usually in the first 1 to 4 weeks following their stem cell transplant, once they've been discharged. And the majority of my patients tell me exactly what I've just highlighted there, that they can do very little. And I just want to normalize that. And the medical sort of rationale for that is that you've been in hospital for 2, sometimes 3 weeks. Your body has been absolutely running marathons. We've administered a big dose of chemo, and for some people it can be several days of chemotherapy. Then we knock your bone marrow out, and your bone marrow has to rejuvenate itself. And then there's all of the other competing side effects that can happen, such as the sore mouth, the sore tummy, the diarrhea. the infections, you need antibiotics. So your body is constantly under an assault, trying really hard to get through this and to recover. And I don't think we respect our bodies enough. It's amazing, the human body, and we do rejuvenate, but it does take time. And particularly after a transplant, I think that last image of that person just completely exhausted just really embodies for me each patient I see in the clinic, and that's often what it's like for them. I just want to qualify here that everybody's experience after a transplant will be slightly different. But the majority of patients will have a level of fatigue, and that level of fatigue can be as significant, like it was for Michael, or can be maybe not as significant. But it's certainly a major barrier, and often comes as a complete shock when you get to that stage. So being prepared for that is important. And there are now a lot of programs that have started to become embedded in a person's pre-transplant workup or pre-transplant sort of planning to make that to make the person as fit as we possibly can get them prior to the transplant. So you've all heard of rehabilitation. Well, there's now this growing concept around prehabilitation. So it's almost like you've got an athlete and you're getting them ready for the Olympics. Well, in some cases, that's very much like it for the patient about to go through a transplant. And we can have, particularly in the case of people with multiple myeloma, your doctor and hematologist might talk to you about a transplant, even right in the early days of first getting that diagnosis. And so we've got some planning time, and now we're using that planning time to try and help the person and get them involved in some prehabilitation programs. So meeting with an exercise physiologist or a physiotherapist, or even yourself at home, just doing things to try and maintain your fitness, or if you can, improve your fitness. And that prehabilitation concept then carries through to the transplant, where the evidence and the literature tells us there's less complications during the transplant, and also the recovery of the patient after transplant is improved. So I've divided up kind of life in that early stages of recovery into a couple of different domains, but I think your physical recovery is something that you're kind of almost slapped in the face with. Suddenly, as Michael described, you get home and you're absolutely wiped out. And that recovery is a very normal process for the reasons I've outlined. And if we normalize some things in our lives, I think we kind of get, okay, this is part of it. My team told me this is what it's going to be like for the early stages. Once I reach home, you think, okay, it's nothing serious going wrong, and my body just needs time. All my patients tell me that their mind is active and they think they can do things, but the body just isn't willing and can't get there. But it will, and you just need to understand that it's a process, and it's a slow process. And there's a couple of tips on that, on the side of that slide, that you can see that it's about a gradual or a gradated process of recovery, and about setting yourself some small goals to begin with. And again, as Michael described, giving yourself that positive affirmation. Hey, I've ticked off, I've gone up the stairs, today, I've had my shower and come back down again. And that may be it for that first 1 week after your transplant. And it might be just doing some, gentle, squats up and down. And some people are able for that, some people are not. Some people, even to go to the letterbox and back completely is exhausting. So it's a process of gradually trying to build up on your small goals, keep track of how you're going, and trying to build on that each day if you can. And consistency is important. It's important to allow yourself to have bad days. It's okay if you have a day where you can't do anything. And I think don't be hard on yourself. You've done such great work. You've gone through the treatment. You're out of hospital. It's okay to allow yourself to have those bad days and just pick yourself up again the next day and just start off again. I think, again, the experience we have in our early post-discharge transplant clinic is often our patients are very, very excited to be out of hospital and say, hey, I'm going to go and do a 5K walk, and then absolutely are wiped out for about 4 or 5 days or even almost a week and can't do anything. So I think, again, steady as she goes, not being too, anxious to get out there and really trying to build up rapidly. And I think building in rest periods and, and acknowledging that you are making progress. And sometimes it's not a day-by-day thing, and that's what we tell our patients. I often say to my patients, because the recovery sometimes can be very slow, you might not see your progress day by day. But if you look back at where you are now in comparison to where you were a week ago, you can definitely see some progress. So that's how I would encourage you to think about your recovery after a transplant. And as I said, it is variable, and some people's experience might be a little quicker than others, and that's okay. And some people's might be a bit slower, but hey, that's okay. The world would be a boring place if we were all exactly the same. So I think being kind to yourself, being aware that this is a normal part of the recovery, and having a slow and steady and consistent approach and rewarding yourself. So physical recovery is a very important part and is something that can be a huge challenge in that early days after you get out of hospital. And of course, factored into that is your nutrition. So, during the hospital stay, you may have experienced some mucositis, which is that, ulcerated, that loss of taste, feeling in the mouth, that can extend right down into your tummy, and nausea can be a factor, diarrhea can be a factor. And just because you've left the hospital doesn't mean all of those symptoms suddenly switch off. And particularly a lot of our care that we deliver in that early post-discharge transplant clinic is about assessing those symptoms for our patients, making sure your nausea is managed correctly for you. Because if you're nauseated and we're not managing it right for you, then that is going to impact on your fatigue levels. Nausea is a horrible symptom. And there's a whole gamut, as many of you will know, of anti-nausea medication. And some anti-nausea drugs will work well for you at some point in your transplant sort of recovery, and other times not. So that's where it's important to communicate with your team. Say, hey, put your hand up, or have a chat with them at your review appointment. Say, look, my nausea isn't really, as well controlled as it was. So these are important things that your team will really be able to oversee, will be able to, change. Your doctor will be able to change around your anti-nausea medication. Usually nausea after a transplant settles down in that 3rd to 4th week. It would be unusual, but it can sometimes happen, but less commonly, to carry into that sort of 5th and 6th week. It's important you let your treating team know, because if you are getting nausea, that's having an impact on your nutritional intake and also an impact on your fatigue levels. The diarrhea associated with the mucositis can continue on as well for a little bit. Usually by the 3rd week, that's starting to settle itself down. If it settled down and got back to normal and suddenly came back again, that's not right. That should be a little alarm bell to say to you, hey, I need to talk to my team. Something else may have crept in, like you may have picked up an infection. So I think managing your nausea and managing that diarrhea is important, because that then is will impact on your nutrition and your ability to tolerate foods and keep foods down. But usually these symptoms settle down in that 1 to 2 weeks after you've been at home. Like I said there, I've kind of, marked out the bullet points that are important. I think taking your regular anti-nausea medication, And important to know right now at this stage, you can eat whatever you feel like eating. So I say to my patients, if they feel like fish and chips, go for it. That's great. It might be some of my patients, it might be a McDonald's, you know. It doesn't really matter now what you eat in these early couple of weeks after your discharge. We can talk about a proper, you know, nutritionally balanced diet, but right now we're wanting to get calories into you because you've lost a lot of your reserve during the transplant. So high calorie foods, there's no evidence to support continuing on with a low risk bacteria diet. So we all now, all the evidence is just, you know, eat what you feel like eating at this stage. And yeah, and just trying to, you know, start off with, you know, small frequent meals and to build on that. Sleep is another important thing in the early stages after your transplant, can get, you know, can be completely out of kilter. And that's that's very, very common. People, when they get out of hospital after the transplant, you're exhausted. Like one of my patients today had his transplant about a month ago. He was sleeping solidly for 12 hours in the first 4 or 5 days. And now he's up at 4 o'clock in the morning and he's saying to me today, you know, what's causing that? And we don't have a good answer for that. But I think, you know, it's when we kind of dug in a little bit deeper, it's having lots of naps in the morning and naps in the afternoon. So it's about looking at what kind of a routine you've got currently. And do you need to maybe pull back on a couple of those naps? Those naps are important in the early stages, particularly in that first week, but maybe pulling back a little bit on that in that kind of second and third week. You know, importance of getting out, getting some fresh air, getting some, you know, sunshine in, but attention to, you know, making sure, you know, you being sun smart. These are the kind of important routines that are important for building up a better sort of sleep routine at night. And sleep is important because it's important to get good sleep, good quality sleep if you can, and that's going to help with your fatigue factor as well. There's some really good links out there, and I've just put this Peter Mac link on the page. It's about improving your sleep and looking at some strategies to help with your sleep, because that can be an area in a person's life that can really struggle throughout all of this. And some of you will be, of course, having a transplant for multiple myeloma and be very familiar with that drug called dexamethasone or steroids, which really have a major impact on our quality of sleep and our quantity of sleep. And so important that you check in with your healthcare team, with your doctors. You know, there are strategies that we can use. That's a useful link at the end of the page on that slide. And also, you know, there's other things, you know, if people are on steroids, those steroids sometimes can be modified. So it's about going back to your treating doctor and telling him how you're feeling. Let me just get on here to the next page. So I guess we've talked about physical recovery, nutritional recovery, the importance of sleep, and also the importance of our emotional well-being throughout all of this. And again, it's people recovering after a transplant have a multitude of different sort of I guess, emotional responses to the treatment, to the processes they're going through. You know, we've taken somebody, we've popped them in hospital, in a ward, you know, removed the person from their social network. Even though you're allowed visitors, it's so hard, right, to be in hospital for a 2 to 3 week period. And, you know, for me, that would be, you know, complete cabin, you know, I would get cabin fever. And I think that's, you know, that's not normal. So we have to recognize the stresses that we put our patients through when we put them through a transplant. And by recognizing them, then we can, again, help you with managing them. So I think a lot of my patients describe it's an emotional roller coaster. So the transplant from the start, getting prepared, the anxiety about coming into hospital. Am I going to be okay? How long am I going to be in hospital for? Being separated, you know, being away from your close network of your partner, your family, your friends. All of this is not normal. So it's very normal to go through quite a range of different emotions, from sadness to feeling angry, to be feeling despondent, feeling frustrated. So again, I would normalize that. And so for you know, tips about managing that is really communicating that, and telling us how you're feeling. And or even if, you know, talking to your close, you know, you have somebody in your close network that you rely on, that's there for you, that's your rock, talking to them, telling them how you're feeling. Because sometimes by talking it through and having that chat can be a really good way of kind of unburdening, you know, the level of stress that you're feeling. There's lots of great counselors out there. There's lots of, you know, in your team, they may be, you know, you've got your social workers, but also got psychologists. So, and also your hematology nurse consultant and coordinators. These are all part of your team. And, you know, it is a team sport, and you're the most important person going through the transplant. And it's about trying to help you get through that. So when we're looking at that roller coaster of emotions, again, I would normalize that, and trying to look at some little tips, and you developing, and, you know, you will know what works for you, and thinking, okay, I'm going to call my really good friend, I'm going to have a chat with them, or somebody close to you that can support you through it, and then talking to your treatment team, because there may be some other additional things that we would, you know, advise and recommend. I think the emotional roller coaster, particularly out of hospital, particularly thinking, okay, I thought I was through my transplant, but all of a sudden now I've got a whole other, you know, recovery process to go through, and that can be challenging, and that can be frustrating. And the fact that your physical recoveries, you know, is not aligned with where you want to be mentally, can be really frustrating as well. So it's about knowing that that's normal. Then there may be the, you know, the fear of the next scan. Am I going to be in a remission after my transplant? What's my bone marrow biopsy going to show? Is my myeloma protein going to be undetectable? And all these fears can creep into our well-being when we're not feeling the best. But trying to think, okay, my team are going to look after that. I'm not going to have my scan until 2 to 3 months. I'm going to focus on, you know, where I can focus on, which is, you know, getting yourself through and focusing on the little tips that we've talked about today. I think sexuality is an important part of who we are as human beings. It's how we express ourselves to others. I think as clinical professionals working in the field, we don't address this as regularly as we should have. There's a lot of focus on, you know, the medical side of things, and, you know, all of the preparation for the transplant, getting you through the transplant, and then out the other end, and getting you back into work, and all of those things. And sometimes sexuality can take a back seat, and that's a very normal thing that can happen. And being intimate with our partners can definitely take a back seat, because we are so exhausted, and you feel so tired, and you have that fatigue factor where you can't possibly, it's just surviving day to day. It can be really what it's like in those first few weeks after you get out of hospital. But the good news is sexuality will become reawakened back in our lives again, and particularly post-transplant. So we know that usually it's very temporary. And as you begin to recover, and as you get back into your routine, and as you feel stronger, these things will start to recover and reawaken in you. But loss of libido is a big factor, and a most common thing that I think our patients struggle with after transplant. And because of that, you know, relationships can be strained. So I think, again, it's about us as professionals raising that with our patients to say, hey, you know, these things, the sexuality and being able to be intimate with your partner does take a back seat. And, you know, how is that going? And just normalizing it for you. And then if you know, it's really important if you are struggling in this field to find somebody in your treating team to talk to about it. So I guess what, you know, recovery after a transplant, it's a temporary thing. It usually recovers as you get stronger, as you get fitter, and as you get back into your role that you identify yourself with before, you know, you had your transplant. And so as the months go on and as you get stronger and as the nausea settles down and the diarrhea settles down, the fatigue level gets right back down, and that can take many months, and it can vary from person to person. And there's no right or wrong recovery time. What matters is what it's like for you, and that you're getting the support to do it and to manage it. But usually, what I say for my patients post-transplant when they ask that question before in the pre-planning phase is that it takes at least about 1 to 3 months to feel like you're about 70% after a transplant, and it might take another 3 months to get to 90%, and it might take another 6 months to get to, you know, 100%. And lots of my patients say, you know, to me, Trish, you know, I never really get back to my former self, but I get back to a different version of my former self that I'm happy with. But in saying that, you know, one of our patients, he's 1.5 years post-transplant, he ran the Melbourne Marathon in October last year. So our patients constantly inspire us. So I guess I wanted to talk now about infection prevention, because infection prevention is an important question that we get asked all the time. And it's an important part of you, because we want you to get back to as well as you can be, to be able to be free, to be able to do all the things you want to do. Particularly in the COVID space, we're all pretty good now at, you know, hand hygiene. We're all very vigilant about, you know, socialization. In the early weeks after your transplant, you know, that's when I would be really be mindful about, you know, socialization and avoiding big crowds, avoiding public transport. Really important to maintain your, you know, your hand hygiene like you've been doing all along. But as you get stronger and as you push away and put more time between you and the date of your transplant, you can relax some of those measures. And I always say to my patients, it's about identifying, well, having a think about what you're about to do. Is it a high risk infection activity or is it a low risk? So high risk will be going out for dinner 6 weeks after your transplant. Now, some of you may not be ready to do that, but some are. In a packed restaurant, nobody's wearing a mask. That's not a sensible thing to do. But, you know, if you wanted to go out for a brunch, sit outside, you're out in the, you know, the open air, your risk of infection is much lower. That would be, you know, a much more sensible, you know, way of getting that, you know, making that first step back into, you know, social integration. So I think it's about recognizing what's a high risk, what's a low risk. Gardening, you know, really important. No potting mix. Potting mix and organic manures are big sources of fungal spores, and they can, as you work with them, they get released into the atmosphere and we can suck these into our lungs. So trying to, absolutely, that's a no-no, at least for the first 3 months after your transplant. And then if you absolutely needed to work with that stuff, you would really need a good strong mask on. So my advice is avoid it where possible. Wearing your gloves. All of these things are important. The other thing that I wanted to say is that if you do get any symptoms of runny nose, sore throat, cough, prompt attention, early investigations of these symptoms, because it could be COVID. And if it is, early start of antivirals is important to nip the infection in the bud. And the same when we get to the flu season, because there's antiviral medications that we can give also for influenza. It needs to be, for it to work best, it needs to be initiated in that first sort of 72-hour period. So seeing your GP, getting your swab done for influenza that's when we're going through the winter is important. And then your treating team, and you'll all be familiar with your preventative antibiotics, your valacyclovir, your Bactrim. These are all important, or something similar to Bactrim. If you have Bactrim allergy, some of you might be on Dapsone or another alternative. So those drugs are really important. And usually after a transplant, we will keep people on Bactrim for 6 months, and sometimes longer if you're on consolidation or maintenance treatment for myeloma that includes steroids. But with the drug called valacyclovir, the big thing is preventing shingles. And shingles is, as Michael alluded to, I think he had an episode of shingles. The valacyclovir usually continues for 12 months, but we're fortunate enough now to have a vaccine to prevent shingles that's suitable for patients going through a transplant and recovering after a transplant. And it's a vaccine called Shingrix, which has really just been made available very, very recently. And the government is putting it on PBS for patients with immunocompromised conditions, including patients recovering after a stem cell transplant. So vaccination is really important after transplant. The reason is that basically as a result of the high dose chemo that we've given you, we've knocked out your immune system, but fortunately your immune system recovers, but it doesn't have the template of the vaccines you had as a little child. So we need to look at redoing those, and they normally start around about 6 months after transplant. The COVID vaccine is slightly different at TAGI, which is our peak organization that advises the health department on what is right for the Australian population in terms of vaccination around COVID, recommends, regardless of how many COVID vaccines you've had pre your transplant, they recommend 3 doses post-transplant, starting about 3 months after your transplant. And the shingles vaccine now is available, and that usually is included in all post-transplant vaccination programs. And now GPs are getting it have it in stock in their clinics as well. Really important, before you get any vaccine after your transplant, you have a chat with your treating team, because there might be some vaccines they may want to hold off on starting. So don't go ahead and have a vaccine through your GP until you've first discussed them with your treating team. And then I guess, Michael mentioned travel, and particularly in one of the clinics I work in, travel is a big focus, and I think it's a great thing to do, and it's something really lovely that you can look forward to and plan for. And it's certainly, not contraindicated, and travel is possible. And in the transplant vaccination clinic that I work in, a lot of our patients are getting ready to travel. So I think couple of things I want to say about travel is, depending on your destination, there might be additional vaccines you may need to have. So having a chat with your treating team first, making sure they know that it's okay and safe, and they can plan with any medicines you need to take with you. Getting good travel insurance, it can be a challenge, but that's important. And, making sure that you have the vaccines on board, and there may be other travel advice that you might need to adopt depending on the destination that you're going to. So those are kind of important. What I've just gone through over the last 20-25 minutes are important aspects of your recovery after your transplant. I haven't gone through, there are others that might come up in our question and answer session, but I might stop here at this point and then hand you back to Linda. Maybe we can, if you have individual questions, we can take them then.
Thank you, Trish. Are you able to stop sharing your screen?
Mm-hmm. Yeah.
Thank you so much for such a comprehensive talk. I think the really important thing that has come up there is about normalizing all the different sort of aspects. Like you said, there's a lot of different things in play when you're in recovery phase, and I think you've covered it beautifully and talked, very much about how it's very individual. There's no set this is how you recover. It's, different for everybody, but there are lots of things to consider. So thank you very much for that.